In this video, here's what we'll cover: what binge eating disorder is and is not, the science, and how it differs from overeating, why it happens, and the shame cycle, evidence-based treatment that works, getting help and support close to home. It is late, and the house has gone quiet. You did not plan for this, but somehow you find yourself eating quickly, barely tasting, feeling as though you cannot stop. It is as if the wanting has taken over, and you are watching yourself from the outside. And when it finally ends, the shame arrives. You promise yourself it was the last time. Tomorrow you will start fresh. And then, in time, it happens again. If you recognize that quiet, private struggle, I want you to hear two things. You are not weak, greedy, or broken, and you are not alone. What you are living with has a name, an explanation, and treatment that genuinely helps. It is called binge eating disorder, or BED, and it is the most common eating disorder in Australia. More than 1 million Australians live with an eating disorder, and most of those cases are BED. Let me start with what binge eating disorder actually is. It is a recognized mental health condition, defined by recurring episodes of eating a large amount of food in a short time, with a real sense of loss of control. What sets it apart from bulimia is what does not happen afterwards. People with BED do not regularly try to undo a binge through purging, fasting, or punishing exercise. It is just as important to say what BED is not. It is not a lack of willpower, not simply a big meal, and not a moral failing. It is not something you should be able to just stop on your own. It is a genuine condition, with biological, psychological, and social roots, and it responds well to the right care. So how do we tell binge eating disorder apart from ordinary overeating? Almost everyone eats a little too much sometimes, at a celebration or feast, and that is a normal part of life. The difference is not really the food, it is the experience around it. The first sign is that sense of loss of control. A binge does not feel like a relaxed indulgence, it often feels driven and automatic. The second is secrecy. Binges frequently happen alone and in private, hidden from partners and family. The third is distress. Overeating at a party might leave you pleasantly full, but a binge leaves you flooded with shame and self-criticism. And the fourth is a pattern. Clinicians look for episodes that recur, on average, at least once a week over about 3 months, along with marked distress. If these signs feel familiar, that alone is reason enough to reach out. Why does this happen? There is no single cause. On the biological side, eating disorders can run in families, and the brain's reward and appetite systems play a part. On the psychological side, we often see depression, anxiety, low self-esteem, perfectionism, and a history of difficult experiences. For many people, binging becomes a way of coping with painful feelings, a brief escape that brings short relief but lasting distress. And on the social side, there is weight stigma, body dissatisfaction, and constant pressure to look a certain way. One risk factor surprises people. Strict dieting itself is strongly linked to binge eating. When the body is deprived, hunger builds, food rules get broken, and the guilt of failing a diet can trigger the very thing you were trying to avoid. This is the heart of what I call the shame cycle. You try to be good and tighten the rules. Pressure builds. The binge breaks through. Shame follows. And to regain control, you tighten the rules again, and the loop starts over. The cruel irony is that the restriction meant to stop binging is often what fuels it. Here is the most important message I can share. Binge eating disorder is one of the most treatable mental health conditions, and recovery is realistic. Cognitive behavior therapy, or CBT, is the first line, evidence-based treatment. A large review of many controlled trials found that CBT produced strong reductions in binge eating, and helped many people stop altogether. A specialized form called Enhanced CBT, or CBTE, was developed just for eating disorders and is recommended as best practice overseas. It helps you build regular, flexible eating, so the body is no longer deprived. It helps you interrupt the triggers that lead to a binge, eases the heavy focus on weight and shape, and builds skills for handling emotions without turning to food. A guided self-help version, worked through with a psychologist, is another effective and often more accessible first step. My role is simply to make this possible, offering a safe, non-judgmental space and walking alongside you as you build new patterns. Cost and silence should never be barriers. In Australia, eligible people can access an eating disorder plan through their GP, which provides Medicare rebates for a substantial number of psychology and dietetic sessions across the year. It is well worth asking whether you qualify. Binge eating disorder thrives in silence, and in a busy, high-achieving area like the Hills District, the pressure to appear fine can make it especially hard to admit you are struggling. Please know that reaching out is a sign of strength. You do not need to wait until things reach a crisis point, and there is no threshold you must reach before you deserve support. If it is troubling you, that is reason enough. At our Bella Vista practice, Potentialz Unlimited, we offer compassionate, evidence-based care for binge eating disorder. With telehealth available across NSW, the cycle can be broken, and you do not have to do it alone. You can read the full guide, or book an appointment, using the links in the description below. Before you go, here's a quick recap of what we covered: what binge eating disorder is, and is not, the signs, and how it differs from overeating, why it happens, and the shame cycle, evidence-based treatment that works, getting help and support close to home.